Greetings to everyone. I am Shweta Salkade and I welcome you all to Imaec Medntek's Infection Control Program. Today we will be discussing about hand hygiene. Since 2009, Global Hand Hygiene Day is being celebrated every year on 5th of May. A theme and a slogan is set every year to focus on the current issues which are related to the infections and subsequent infection preventive practices in the healthcare facility as well as in the community. So this year, that is in 2022, on 5th of May, the hand hygiene theme was healthcare quality and safety climate or culture. Similarly, the hand hygiene day slogan was unite for safety, that is clean your hands. We are not aware of the organisms which are surviving or present on our hands as they are not visible to our naked eyes. As you can see in the picture, there are various n number of organisms which are present, but these are not visible to our eyes. However, these organisms are able to survive for several minutes on your hands. Hands are our first point contact, and hence hand hygiene is one of the most important elements of the infection control activities. Hand hygiene alone can significantly reduce a lot number of organisms from your hands. If you are performing hand hygiene continuously with the proper steps and with the proper contact time, then you can make sure that your hands are completely free of any kind of organism, and therefore there won't be any kind of cross transmission of infection in the healthcare facilities. Now this is a pictorial depiction of the bacterial flora which is present on our hands. Our hand consists of the normal bacterial flora like the Staphylococcus epididymis, coagulase negative staphylococci, S. aureus, etc. But these hands can get contaminated with various number of other microorganisms like Serratia marcescens, S. liquefaciens, etc. And eventually these organisms are responsible for causing the infection. So the cross transmission of organisms by contaminated hands will cause an infection of the S. marcescens, whereas because of the defective hand cleansing, methicillin resistant Staphylococcus aureus and vancomycin resistant enterococci are the organisms which are going to cause the infections, and MRSA and VRE infections are the deadliest infections because these are the antibiotic resistant strains. So how can you control these types of infections? So you need to perform proper hand hygiene with the correct steps and given contact times so that the pathogens which are surviving on your hands will get eliminated. The transient flora or the pathogenic organisms can survive on your hands and multiply sporadically. Most common organisms like E. coli can survive on your hands for around 6 minutes, while Pseudomonas aeruginosa can survive on your hands for 30 minutes. Similarly, VRE, that is vancomycin resistant enterococci, can survive on your hands for around 60 minutes. Now, how will these organisms transmit or spread? These pathogenic organisms can be transmitted by the various modes of transmission from an infected patient to a susceptible individual, like in droplet form, airborne, direct contact, indirect contact, waterborne, foodborne or vector-borne modes. The microbiome of the hands is in constant flux as the hands are a critical vector for transmitting the microorganisms between the people, pets, inanimate objects and the environment. Now we will look into the major things of the transmission routes. If we are considering this as an infected individual, then certain actions like coughing, talking and sneezing will release the droplets from this particular infected individual into the environment. Once the droplets are out into the environment, the droplets can transmit by 4 ways to a susceptible host or a susceptible individual. First one is directly in the droplet form by the mode of ingestion, that is the droplets from the infected individual can directly enter into the susceptible patient's body either by nose or by mouth if the susceptible individual is standing near to the infected individual. The second mode is by the airborne transmission, wherein the particular droplet can travel to cause the infection known as the airborne infection. The third one is the direct contact. The hands of this particular infected individual as well as the healthcare workers will get infected with the particular droplets of the organism, and from those hands it will directly cause the infection to the susceptible individual. The last one is the indirect contact, wherein if this particular infected individual touches a particular surface and the susceptible individual comes in contact with that particular surface, then through indirect contact the infection can spread. Here you can see that the particular germs or the particular microorganisms after sneezing and coughing are coming out, and here this particular individual is directly transmitting whatever organisms are present into the susceptible patient's or susceptible individual's body. Now, how can you reduce these particular infections? The answer is by the use of the various hand rubs or hand sanitizers. You can use any form of the hand sanitizer, be it a gel form, foam form, cream, spray or even wipes. There are a lot amount of compounds which are used in sanitizers. So these compounds are either alcohol based or alcohol free. The ones which are used in alcohol based are ethanol, isopropanol and N-propanol, whereas in alcohol free you have chlorhexidine solutions, quaternary ammonium compounds and triclosan. Moving towards the alcohol-based hand sanitizers. Now, alcohol-based hand sanitizers either contain ethanol, isopropanol or N-propanol in the concentration of 60 to 95% because this concentration exhibits an optimum bactericidal activity, that is the bacterial killing activity. The 2015 WHO model list of essential chemicals have recommended that a concentration of 80% of ethanol whereas 75% of isopropyl alcohol are very potent and effective in killing the bacteria and most of the organisms. Similarly, ethanol in the range of 60 to 85%, whereas isopropanol in the range of 60 to 80% and N-propanol 60 to 80% appears to be most effective against the viruses. So when you are using any kind of an alcohol-based hand rub or an hand sanitizer, what you need to do is you need to put the particular sanitizer on your hands. Cover all the surfaces of your hands with the proper hand rub steps which are given by WHO for the perfect contact time, that is around 20 to 30 seconds until the whole hands feel dry, that is the ethanol or the any other alcohol is evaporated. Now coming towards the different types of hand sanitizers, alcohol based we have discussed right now. Second one is the H2O2 based. This H2O2 based means the alcoholic solutions with like ethanol and isopropyl alcohol with slight amount of H2O2 will inactivate the contaminating spores which are present in any kind of bulk solutions of alcohol or even in the excipients. Use of chlorhexidine gluconate. Chlorhexidine gluconate has a good activity against gram-positive bacteria and envelope viruses. However, it is ineffective in killing certain gram-negative bacteria, fungi and the non-enveloped viruses. Then you have the non-alcoholic or alcohol-free products or the alcohol-free hand rubs, which consists of the compounds known as the quaternary ammonium compounds. One such example is the benzalkonium chloride and the benzethonium chloride. They have a very good activity against positive as well as gram-negative bacteria, enveloped viruses, as well as certain weak activity towards the fungi and the mycobacteria. Now coming towards the mode of action of the alcohol. So the basic mode of action of alcohols is the denaturation of the proteins. Now proteins play a very important part in any kind of a cell membrane or even in the viruses. So you can see in this pictorial depiction, if this is a bacteria and this is a virus, if you are performing proper hand hygiene with alcohol, then what will happen is there will be inactivation of the bacterial's lipid membrane by the lipid membrane releases, that is killing and release of the intracellular content. If it is a virus, then the lipid membrane of the virus will get cut as well as the proteins will get denatured, and therefore the virus won't be able to cause any kind of infection. Now we understand or we have heard about the terms known as the log reduction, or we have heard of the terms like 99.99% reduction. So what do you understand by 99.99% reduction? If I can say that I have around 1 lakh organisms present with me, and if my product is claiming that it is giving 99.99% effectivity, then from this 1 lakh organisms, only 100 organisms are remaining after using a particular product. So that means it is giving 4 times reduction. Hence it is known as 4 log reduction or 99.99% reduction. WHO and CDC have recommended that whenever in healthcare facilities, you need to use either 4 log or 5 log reduction products in the critical areas. Now, WHO has given the 5 moments for hand hygiene and 8 steps to perform the hand rub. So, before touching a patient, you need to perform the hand hygiene. Before any kind of a clean or aseptic procedure, you need to perform the hand hygiene. Once you are exposed to any kind of a body fluid of a particular patient, then you need to perform hand hygiene. After you have touched the patient completely and completed the procedure on that patient, then you need to perform the hand hygiene. And after touching the patient's surroundings, before going to another patient, you need to perform hand hygiene. So these are the 5 moments, and you can see that these are the 8 steps which you need to perform for hand rub. So we come with various kinds of solutions for the hand rub and for performing the proper hand hygiene. First one is Sedaltec IP, consisting of isopropyl alcohol 75% with a slight amount of hydrogen peroxide as well as glycerol. Then you have Sedaltec EN, which consists of ethanol 80%, H2O2 as well as glycerol, and you have Sedaltec NaHS, that is non-alcoholic hand rub, which consists of benzethonium chloride 0.2% and an aqueous base. I hope you have understood the importance of performing hand hygiene, and I hope that henceforth you will perform all the correct steps and with the perfect contact time to have a free organism free hands. Thank you. For more details you can contact and visit our website as well as on social media. Thank you.